Doing really well here, Neil. And you?
Good. And today's topic is intussusception. What is intussusception?
Well, it's actually a telescoping of the intestine so that one piece slides over the other piece. And it
Is
can create a blockage or obstruction.
uh is intussusception serious?
Well, yes, it can be more than serious. It can be deadly. It has to be treated the right way at the right time.
What are the symptoms of intussusception?
Well, the first one would be abdominal pain, but of course, if you have a 6-month-old, they're not going to talk about it. So then you have to look for bloating. You have to pay attention to their bowel movements. In the beginning, you're probably going to have diarrhea. Some people say constipation, although I doubt that. But eventually, if this goes on long enough, you're going to have vomiting and you'll have no gas and no stool.
Why is intussusception so dangerous?
Well, it's because the first problem with the telescoping is that the blood supply is shut off. So there's a lack of oxygen. And when you have a lack of oxygen, you have, or it's what we call ischemia, then you run the risk of having necrosis, which would be dying bowel. And that is very dangerous and it is deadly if it isn't cured.
Can mild symptoms be intermittent?
Well, actually, most of the time, Neil, this is intermittent. And that's one of the problems because parents can think that it's just because they've had it 3 times before and they've gotten over it by themselves, they'll do it again. So that can actually delay the diagnosis and the treatment.
What are the causes of intussusception?
Well, nobody knows for sure. One of the things we say is that it's unknown. That's always an answer. So, but it's very young people under age 3. Some people say viral infections, food allergies, trauma. So nobody really knows. I think the main thing to remember is that this is an illness of children less than 3 years old.
How is intussusception diagnosed?
Well, there'd be, of course, bloating, and that would be one of the things that parents would be able to find. And then the abdomen would turn hard. There'd be less gas. But if you're talking about having a diagnosis by medical people, then you're talking about ultrasound studies and imaging studies like barium enema and other contrast studies.
How's intussusception treated?
Well, it can be treated in many ways. In the first place, sometimes time. These things come and go often for a lot of children. But again, a barium enema is one of the treatments. Another treatment is an air enema. And I think a lot of times we'll wind up with surgery um, because of the possibility of the ischemia, that is lack of blood supply, and the necrosis or the dying bowel.
Is intussusception common?
Well, it's not all that common. It is most common in children under 3. So, and again, it's dangerous the younger the child is because they're not going to be able to tell you that they have a sore abdomen.
All right, the best place to go is RollDocAllen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Roll Doc.